Okay, hey, it's Gilly Carter. This is my neurological assessment video. My patient today is my dad again. Um, so, like I said before, if this was a real life situation, we would have already done the objective data, answer any of his questions, have him change into a gown, explain what I'm about to do to him. For this assessment, I would also ask him questions that pertain to like person, place, time, situation, stuff like that to see if he could answer those, and that would kind of gauge how I would do the rest of my exam. So I would ask his name, his date of birth, who's the president, where he's at, maybe have him repeat 3 separate words that I give him in like 5 minutes to see if he remembered. So I'm just going to go ahead and begin. I'm going to begin with assessing the cranial nerves. so, cranial nerve 1 is the olfactory. So what I'm gonna have you do is so you're gonna kind of clear your nose, make sure you're good, and you're gonna close your eyes and hold one nostril closed. Okay. So I'm gonna put a scent in front of one nostril, and you tell me what you think it is. Okay, you ready?
Big Sal.
What does it smell like? What flavor?
Wintergreen.
Yes. Toothpaste.
Toothpaste.
All right.
Okay.
Now, close the other nostril and close your eyes. What do you think that is?
Coffee.
Yes.
Coffee. Coffee.
All right, so he correctly identified the scents bilaterally. So we're going to move on to the optic nerves. If I had a Solon chart and an ophthalmoscope, I would do that now. I would have him read the chart, and I would have the ophthalmoscope, and I would check his optic discs and retinas. But what I am going to do is I'm going to have him read a small little paragraph on a bill or a newspaper. Right now I just have a bill, and I'm going to assess his near vision. So you can put your glasses on. So just read.
Things have changed. Let us know if there's any of the following have occurred since submitting your request.
Good. All right. So full visual fields were assessed. Now I'm going to move on to cranial nerve 3, 4, and 5, which is the oculomotor, trochlear, and abductans. I hope I said that right. So what I'm going to do with my pen light, here we go. Pen light is I'm going to do the 6-point test. I'm going to have him follow the tip here, and then I'm going to have him look at the tip and look at my ear. So what you're going to do is look at my ear, look at the tip of this. One more time. Look at this. Now follow just with your eyes. Good. Okay. Now I am going to switch and check the constriction of his eyes. So I'll turn on my pen light here. Ready? Just look forward. Good. Okay. I'll put those back on. Very, very good. I would also at that time check for ptosis, see if there's any droopage there. I would say there is a little bit, but that is within the age range, so it seems to be within normal limits. So the movements were smooth, coordinated, and there was bilateral constriction. So we're going to move on to cranial nerve 6, which is trigeminal. I'm going to have him kind of clench his teeth, and I'm going to palpate the temporal and the masseter muscle. So clench your teeth. Any pain when you do that? Clench. Clench. Okay. Good. Very good. Both contract bilaterally. So now I'm going to test sensory function. So I'm going to get this paper clip. So I am going to have him close his eyes, and I'm going to touch different parts of his face, and you're going to tell me if this is sharp or dull. Okay, so close your eyes. What would you feel?
So. Sure.
Mm-hmm. So he correctly identified the stimuli. So we're going to check the coronal reflexes. So Dad, I'm sorry. I'm going to get one of these little 2x2s here. And take off your glasses and just kind of look towards one side. I'm going to kind of lightly touch the edge of your eye to see if you have a reflex and blink. Good. Go this way. Okay. All right. Very good. He does have a reflex. So now I'm going to check the central cranial nerves number 7, which is facial. So what we're going to do is you're going to smile, frown. Can you kind of wrinkle your forehead? Raise your eyebrows. Close your eyes. Perfect. Good. Okay. Next is acoustic. So I would perform the Weber, the Rhine, and the whisper test. So I do have a tuning fork. So for the Weber, I'm going to strike it and put it in the middle of his forehead, and he's going to tell me if he feels a vibration. You ready?
Oh, yeah.
Okay, now I'm going to do the Rhine. So you tell me which side is louder, A or B, okay? So ready? This is A. B.
B.
Okay. Ready? A. B.
B.
Good. All right. Very good. So he accurately, oh wait, I'm sorry. We're going to do the whisper test. So I'm going to be behind you, and I'm going to whisper a number in one ear, okay? And you tell me what it is. You ready? I'm going to go for your right side.
33.
Yes.
28.
Good. All right. He accurately repeated what I whispered about a foot away. So now I am going to go to the cranial nerve number 9, which is the glossopharyngeal. Then I'm going to go to 10, which is the vagus. So I would get a tongue blade, which I do have. And I'm going to check his palates. I'm going to check his uvula. I'm going to have him say ah and note the rise and fall. Are you ready? Good. All right. One more time. Looking in his palate. Okay. Let's see. I noted the rise and fall. Palate looks soft. Let's see. I will do the gag reflex now. So I'm gonna kind of stick it a little bit for our CP choke. I'm sorry.
That's bad.
You ready? You good?
Yeah.
Okay.
I do that every night with my toothbrush.
Can you get your drink and drink some water
Sure.
for me real quick? I'm just gonna assess the swallowing. Good. No issues. No issues there. We tested the gag reflex and the swallowing, and he passed. So what I'm going to do now is move on to cranial nerve number 11, which is the spinal accessory. So what I'm going to have him do is he's going to kind of shrug his shoulders, and I'm going to put resistance against it. So let me put this up real quick. Shrug your shoulder. Good. Now you're going to kind of push against resistance. Good. On the other side? Good. All right, very good. So, let's see, both sides were symmetric and strong against resistance. Last, on the cranial nerves, it's the hypoglossal. So I'm going to get a tongue blade again, and I'm going to have him stick out his tongue, and I'm going to have him kind of put resistance against it. Let me get my tongue blade again. So, to the left. Good. Now to the right. Good. All right, good. Very good. Movements were symmetric. So now I'm going to move on to the motor and the cerebral systems. If this was a real life setting, I would have probably assessed his gait when he walked in. I'm assessing for balance, the use of moving his arms, shuffling. So if you could just kind of just get back here, Dad, and just walk forward. I'm just gonna, or walk back to me. Okay, good. Now what you're gonna do is heel to toe. Just a few steps, heel to toe. Good, okay. On one leg, bend one knee, in, and then kind of hop. Good, under the other side. Good, all right, very good. Have a seat. So, I evaluated his gait, his balance, everything seemed to be normal, no unusual tics or anything. His, at this point, I would assess all of his muscles for size, symmetry, tone, strength. I'm just looking, if I had a measuring tape, I would do that too. I'm looking for atrophy. Stick out your legs, Dad. Just assessing for any kind of weakness, anything that stands out. Everything looks symmetrical, no atrophy. He didn't have any abnormal movements or tics or anything like that. He was able to walk heel to toe without any difficulty and hop on one foot. He didn't lose balance. I would now move on to assessing his coordination. So what I'm going to have you do is you're going to get one index finger like this, and then the other one. I'll switch. Do 1, 2, 3. 1, 2, 3. One more time. Good. All right. Okay. Very, very good. Now I would have him do kind of a quick, rapid movement thing. So what you're going to do with your thumb, you see how I'm doing this? Thumb, finger, 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 finger. See that? Yeah. Do the other hand. Good. All right. Good. Okay. Then I would have him have his palms on his thighs like this, face down, and then you're gonna as fast as you can. Okay. See? Good. All right. Very, very good. Okay. And he was able to perform that with no hesitation. If I did have a bed, kind of lay back a little bit. What I'm going to have you do is kind of, with your heel of one leg, kind of rub your shin up and down. Okay, do the other side. Good, okay. All right, he was able to perform that with little hesitation. So now I would move on to the sensory part of this. I'm going to assess for touch, for pain, and for temperature. So at this point, I would touch various spots on his extremities with something either dull, sharp, soft, and then I would assess cold and hot. So let's see, I don't know if this is still, I took these from work. So Dad, what I'm gonna do now is you're gonna close your eyes and tell me if it's hot, cold, dull, or sharp, okay?
Dull.
Mm-hmm.
Sharp. Hot. Sure. I can't tell with that one. Soft.
Okay, yeah.
Hot. Soft. Yes, that's cold. Sharp.
Okay, very good. He was able to accurately tell me if it was hot, cold, sharp, or dull. And he was able to differentiate between those very easily. So now I'm going to test for vibratory sensation. So again, I'm going to use the tuning fork. And at different places, I would either his forefinger, the radius, let's see, I want to say the inside of the ankle area and his big toe. He's going to tell me if he feels any vibrations. Okay, so stick out your finger. Okay.
Oh yeah.
Okay, other side.
Oh yeah. Definitely. Oh yeah.
Okay.
Oh yeah.
And do the inside of his ankle.
No, of course.
Toe.
Sure.
Other side.
Yeah. Oh yeah.
Okay, very good. So he was able to feel those. So now I'm going to test the sensitivity to position. So what I'm going to do is you're going to spot your hands kind of like this, close your eyes, and you're going to tell me which way, up, down, or side to side, am I moving your finger. Okay, ready?
Up. Out. Down. Up. Out.
Good. Very, very good. He correctly identified the directions. Now I'm going to test for, I hope I said this right, stereogenosis. So what I'm going to do is place two objects in his hands, and he's going to have his eyes closed, and he's going to try and tell me what they are. So I have this, and I have this. So close your eyes. I'm going to place something in your right hand, and you just keep your eyes closed and tell me what you think it is.
That's like a key.
Mm-hmm. Good. Now, other hand.
It's a coin.
Mm-hmm. He accurately described those. So now I am going to test for point localization. He's going to close his eyes, and I'm going to be touching on various parts of the body that he doesn't know, but he's going to tell me where, okay?
Right arm, shoulder, right arm, left thigh, right foot, left arm, the right hand.
Okay, good. He did that accurately. So now I am going, and again, I'm probably going to butcher this name, graphophagia. So what he's going to do is close his eyes, and I'm going to trace a number in his hand with my Sharpie, and I'm going to ask him to tell me what that number is.
3.
Mm-hmm. Oh, it's kind of upside down. Sorry.
Okay. That's a 2.
Mm-hmm. Good. All right. Very good. So he accurately told me the correct numbers. I would do extinction now. So he's going to still have his eyes closed, and I'm going to also touch certain areas of the body, but it's going to be on the same sides. But he's going to have to tell me where I'm touching. Okay, you ready?
Right. Both sides legs. Both sides hands. Both sides arms.
Good. Okie dokie. So now, well, he correctly identified the points touched. So now I would move on to checking his deep tendon reflexes. It would be on his bicep, tricep, brachial radius area, his patellar, and his Achilles. So I do have a reflex hammer. So what I'm going to do on both sides, let's see, kind of, I'm just feeling kind of for that tendon. Good. All right. So that was the biceps. Now I'm going to do the triceps. So kind of bend this a little bit. Okay. Then I would move on to I'm gonna butcher the name again, radialis. So, just here's your radial area. A bit further down. On top. Okay. Sorry. Okay. If I had a higher chair, I would be able to kind of have his legs dangle, and I could check for the patellar a little bit better. Let's see if you can. You don't have to do that, Dad. Let's see. You probably can't see it on the thing, but I'm hitting kind of in this area, a little bit lower than the kneecap. Again, I need a chair that kind of has you dangling your feet. And then last, I would do the Achilles down here. So, go for the Achilles. I know you can't really see it. Hurt?
No.
Okay. So, let's see. The normal range for those is 1+ to 3+. He pretty much was normal, so it was 2+. Then I would now check the ankle clonus. I don't know how to say that. So what I would do with one hand under the knee, I would kind of dorsal flex his foot up to his head. And I'm just checking for like contractions or anything. So I'm just kind of, okay. I'm supporting the knee with my hand and I'm moving his foot up. Good, okay. Very, very good. Next, I would check his plantar reflex. So go ahead and kind of lay back a little bit, and I'm just going to rub the bottom of your foot from your heel all the way up.
For you. Ooh.
I'm just checking for any kind of bending of his feet. Tickle? A little bit? Okay. All right. Now I'm going to check his abdominal reflexes. I'm going to kind of lightly stroke on a little bit below the umbilicus to see if there's any muscle contractions there. Sorry, Dad.
Right.
Yep, there's a contraction. Since he is male, I would check for, I'm going to butcher this, the cremastic reflex too, and that would be on the inner thighs to kind of see if his abdomen kind of retracts too. Yep, good. So if I suspected meningitis or any other type of inflammation, I would also go into the Rudinsky, checking for that, and the Koenig sign. Again, I'm not very good with names. So, but he is normal, and that concludes my video, and let me know what I need to work on. Thank you.